Good morning students. In continuation with the sessions on maternal and child health, today we are going to discuss about adolescent health. We are going to discuss which age group is considered as adolescents, why they have to be considered as special group, what are the public health implications of adolescent health, what are the health problems adolescents face, what are the barriers for utilization of healthcare services, and what are the programs and intervention available in India. Adolescence is the period of development between childhood and adulthood. This is a period of transition with many changes including physical, psychological, emotional and social changes. Adolescents develop desire for exploration, experimentation and identity formation. They also evolve new personal relationships and they try to obtain a place in society. These changes are very important. If these things are not focused properly during adolescent period, this will have an impact during their adulthood. Adolescence is the age group between 10 to 19 years. This can be further categorized into early, mid and late adolescent age group. These are the different changes which occur during adolescent period. Biological, which includes physical, physiological, sexual and other changes. Cognitive changes, emotional and social changes. So now why they have to be considered as a special group? Adolescents constitute about 21% of total population in India, and this is a period of rapid physical growth, sexual and psychological changes. Adolescence is the last chance to correct the growth lag which has occurred during the period of childhood. Habits and behaviors like substance abuse, eating habits, conflict resolution and other behaviors which are picked up during the adolescent period will have a lifelong impact on health during adulthood. Some adolescents are sexually active, but the problem is they lack information about self-protection. This may lead to occurrence of sexually transmitted infections and HIV. And they also have different reproductive health needs. Menstrual hygiene, contraception and other information has to be provided to them. And the major problem is there is communication gap between adolescents and their parents and also adolescents and the healthcare personnel. And there is a generation gap which is considered to be there between parents and the adolescents, which also hinders them to get the information about few healthcare needs. These are different public health informations why we have to focus on adolescent health. 70% of the mortality in adulthood are linked with the habits which are picked up during adolescence. And the intergenerational effects of malnutrition, anemia, lack of immunization, other things have an impact on maternal mortality and infant mortality rate. Lack of information about protection from sexually transmitted infection will lead to increase in occurrence of reproductive tract infection, sexually transmitted infection, HIV and its related social problems. Pregnancy during adolescent period will have higher risk of maternal mortality, infant mortality and low birth weight. Risk-taking behavior which will be present during the time of adolescent period will have an impact on adulthood. There are many health problems that may occur during adolescent period. So nutrition problems, mental health problems, communicable diseases and few others. Nutrition problems include malnutrition, eating disorders and obesity, and these are all the mental health problems and communicable diseases. In unintentional injuries, intended injuries, substance abuse and sexually transmitted infections usually occur because of a consequence of risk-taking behavior, and trafficking, prostitution, pregnancies, illegal abortions, all these things have psychosocial implications. There are many factors which act as barriers for utilization of healthcare services. This may lie at the level of individual or health system. Lack of awareness about the illness, lack of awareness about the place and type of services provided for their illness, and most often adolescents feel uncomfortable in discussing their issue with the healthcare personnel. Health center may be located in an inaccessible area and the working hours may not be suitable for them. The cost of service and then the transport available for the health center may not be appropriate, and there will be lack of privacy and confidentiality in few healthcare centers, and for few procedures healthcare personnel require consent from the parents. So all these things act as barrier for utilization of healthcare services by adolescents. I have included few case studies for you to understand what are the major health problems among adolescents. The first case study is about malnutrition and anemia. Go through this. The second case study is about mental health. And third one is about reproductive health issues and the need for adolescent-friendly healthcare services. While we are providing adolescent-friendly healthcare services, this will improve the healthcare utilization among adolescents. Go through all these case studies. Among adolescents, there are few target groups which we have to give more focus: rural and tribal youth and adolescents, out of school, female, adolescents with disabilities, and adolescents those who are under special circumstances like victims of trafficking, orphans and street children. There are few interventions that has to be provided to improve the health of the adolescents. So life skills and providing health and sexual education in schools, including peer education, because most often they may not be comfortable in discussing few issues with their parents and healthcare personnel. If peer education or peer group discussion is included in the schools and in colleges, this might improve the awareness level among adolescents and further it might improve the healthcare utilization. So providing information in mass media, and further this will improve community mobilization. Youth development programs, it is mainly for out of school youth and street children and street adolescents. Improving the clinical healthcare services that are being provided, so that should be adolescent friendly, and social marketing of adolescent services available, and workplace and private sector programs for adolescents, those who are in work settings. Now we are going to discuss about health programs which are present in India for adolescents. I am going to discuss mainly about nutrition related programs and direct healthcare programs. So first we are going to discuss about Kishori Shakti Yojana, which was implemented to empower adolescent girls. The first objective was to improve nutritional health status of adolescent girls aged between 11 to 18 years, to provide literacy and numeracy skills, to promote awareness about health, hygiene and nutrition, to improve their understanding about environment related social issues, and it also provides iron folic acid supplementation and deworming and education for adolescents, those who are school dropouts. Now we are going to discuss about Balika Samruddhi Yojana. The program was launched in 1997. The major objective was to change the negative attitude of family and community towards girl child. It focuses on improving the school enrollment for adolescents. Once a girl child completes school education, they will cross the age of 14 or 15. This will further increase the age of marriage of girls. The program benefits girl children, those who belong to below poverty line families, and the benefit will be provided to two girl children in a family. Immediately after birth, initial amount of 500 will be deposited in the child's account, and once the child crosses the level of school education, specified amount of money will be deposited in the child's account. So now we are going to discuss about Sabla, that is Rajiv Gandhi Scheme for Empowerment of Adolescent Girls. The major objective was to improve the nutrition status of the adolescent girls and improve their home skills, life skills and vocational skills. The program provides supplementary nutrition, weekly iron and folic acid supplementation and life skill and vocational skill training. Now we are going to discuss about the major health program which focuses on adolescents. RMMCHA, that is Reproductive, Maternal, Neonatal, Child Health and Adolescent Health Program. Thus the adolescent health component was there even in RCH2 program, and now when it was converted as RMMCHA, the many components are included under adolescent health. RMMCHA has two most important strategies for adolescent health. So first thing is adolescent reproductive and sexual health services, and then adolescent friendly health services. Adolescent reproductive and sexual health service was included under RCH2 in 2006. This is provided to all married and unmarried adolescent girls and boys. This has 5 different categories of services. So it focuses on promotive, preventive, curative, outreach services and referral services. Under promotive services, it focuses on adolescent antenatal care, counseling and providing emergency contraceptives, provision of other contraceptives, whatever is needed, and providing information and education on sexual and reproductive health services. Preventive services include TT vaccination and IFA prophylaxis for nutrition anemia, nutrition counseling and self-termination of pregnancy. Curative services for all health problems. Referral services for investigations and emergency management of health problems. outreach services to community camps, and then school health services. Adolescent-friendly health services include general examination, reproductive health services, pregnancy tests, STD screening, nutrition and others. To be an adolescent-friendly health service, a health worker should be welcoming, friendly, knowledgeable, understanding and a good communicator. A health center should be in an accessible location with proper security and privacy, and it should provide quality care for adolescents. Haryana has developed a best adolescent-friendly health service model by adolescent action groups including peer educators. This has shown to improve the healthcare utilization. Thank you.